Hello and welcome to 5 Minute Videos. This is Dr. Pepe, and today we are going to be talking about Domain 2, and we are going to cover subdomain Q, obtaining clients' self-report information. Now, let's talk about what is self-reports. Self-reports are any type of survey, measures, test, or any type of information that describes things like symptoms, behaviors, beliefs, or attitudes. Typically, self-reports are gathered in paper pencil, or they can also be in electronic format, and usually self-reports are used both in counseling as well as in psychological studies. Some examples of self-report that you should be familiar with are different measures or different tests. Some examples would be the MMPI, or the Minnesota Multifaceted Personality Inventory, which is a assessment of 500 questions that looks at different areas such as behavior, psychological health, relationships, and attitudes. Other self-report data could be the 16 Personality Factor Questionnaire, or PF for its acronym. Other self-reported data could be the Myers-Briggs Type Indicator, or MBTI, and this is a self-reported personality measure, which looks at things like introversion or extroversion, sensing or intuiting, thinking or feeling, judging or perceiving, and then you get a different score depending on kind of your leaning. So like a introvert would be an I, a intuiting would be an N, a thinking would be a T, and then a perceiving would be a P. So many people would say, "Oh, I'm a INTP," referring to the Myers-Briggs self-report. Some of the advantages of collecting self-report data is that it can be fairly easy to obtain, um, and based off different forms, you can just have a gathering of data, which could be fairly easy as well as inexpensive. Some of the disadvantages can be, the notion of confidentiality. That could be a type of disadvantage. Other things, especially with some of the tests, there's the issue of bias, such as, are the clients answering honestly? Do they have the ability to think critically when taking those types of assessments? Also, the interpreting the questions, that's also something that can be a bias. So, for counselors in the field, one of the things that you are to consider when collecting self-reports is to consider a multimodal or multi-method of collecting data, not just relying on one data point or one test, but to look at things from different perspectives in order to gain better insight of the self-reported data. And it's also important to look at things like biases, to look at, are these tests developmentally or cognitively appropriate for the client, and are they capable of understanding in their language as well as are they capable of answering honestly, and that's where that notion of bias comes in.